Welcome to this explainer. Today, we're diving into the complex and frankly tragic 25-year history of the opioid epidemic. It's a heavy topic, right? One that's impacted countless communities across the country. But we're going to unpack the data to uncover not just the stark realities of this crisis, but also some really surprising glimmers of hope that are finally starting to emerge. So let's just get right into it.
To truly grasp the scale here, we've got to look past those massive macro-level datasets for a second and just look at the daily reality. In 2023, an average of 217 people died every single day from an opioid overdose. Pause and really think about that for a second. 217 individuals, families, entire communities impacted every single day. It completely grounds our discussion in this very sobering reality before we even start looking at the broader trends.
Here is our roadmap for this explainer. First, a crisis in numbers. Next, the 3 deadly waves. Then we'll look at the current drug landscape, how we're confronting the epidemic, and finally, the power of collaboration.
Section 1. A crisis in numbers, looking at the staggering scale and a surprising shift.
Let's start with the hard data from 2023. Out of the roughly 105,000 total drug overdose deaths that year, about 76%, that's nearly 80,000 deaths, involved opioids. To put that massive scale into perspective, the number of people who died from an opioid overdose in 2023 was nearly 10 times what it was back in 1999. In fact, if you look at that whole timeline from 99 to 2023, we're talking about approximately 806,000 lives lost to both prescription and illegal opioids. It's just an astronomical toll.
But here is that surprising glimmer of hope I mentioned. Despite those massive historical numbers, 2023 actually marked the first annual decline in the overall opioid overdose death rate since 2018. It dropped by 4% from the previous year. And when you break that down by drug type, the shifts are huge. We saw a 2% decrease in deaths involving synthetic opioids, a nearly 12% drop for prescription opioids, and get this, a massive 33% drop in heroin-related overdose deaths. That's a critical turning point, showing us that prevention efforts can and absolutely do have a measurable impact.
Moving to Section 2, the 3 deadly waves, and exactly how we got here.
The CDC basically tracks the evolution of this crisis across 3 distinct waves. The first wave kicked off around 1999, and that was driven primarily by a big increase in the prescribing of natural and semi-synthetic opioids, as well as methadone. Then Wave 2 hit around 2010. This one was characterized by rapid, sharp spikes in overdose deaths involving heroin. And finally, the third wave began in 2013, bringing this massive surge in overdose deaths involving synthetic opioids. So each of these chapters fundamentally changed the very nature of the threat we were dealing with.
Which brings us to Section 3, the current drug landscape, specifically the rise of synthetics and polysubstance use. Okay, so the crucial point here is that IMFs, that stands for illegally made fentanyl and its analogs, are absolutely driving the modern crisis. These highly potent synthetic opioids have pretty much saturated the entire illegal drug supply. And the terrifying part, they don't usually just appear on their own. They're often found in powder form or pressed into counterfeit pills that look exactly like standard prescription meds. On top of that, they're frequently mixed with other drugs, including non-opioid sedatives like xylazine, and you can imagine that makes responding to overdoses exponentially more complicated for medical professionals on the ground.
We're really witnessing a scary evolution here. In the past, overdose deaths were primarily driven by just a single substance. But today's reality? It's all about polysubstance use. In a subset of jurisdictions they studied in 2023, nearly 47% of drug overdose deaths involved a lethal mix of both opioids and stimulants. So modern overdose deaths are rarely just one drug anymore. And this overlapping mixture makes intervention, treatment, and reversal incredibly complex.
Section 4. Confronting the epidemic through strategic responses and actions.
Now, despite how heavy this all sounds, the CDC is fighting back with a really comprehensive, multi-pronged strategy. They're monitoring real-time trends to quickly spot outbreaks. They're advancing research and improving data quality to figure out what prevention efforts actually work. They're also actively supporting healthcare providers with tools to improve clinical prescribing and patient safety. Plus, they're partnering right alongside public safety officials and law enforcement to target the illegal opioid supply, all while boosting public awareness so people can make safer choices.
A major cornerstone of this whole strategy is a cooperative agreement called the Overdose Data to Action Program, or OD2A for short. This program is huge because it provides critical funding directly to 90 state and local health departments. The goal is to comprehensively track both non-fatal and fatal overdoses, and then seamlessly turn that real-time data into immediate, life-saving prevention activities. It's basically all about equipping local jurisdictions with the exact resources they need to understand this fast-moving crisis and actually respond effectively.
And finally, Section 5, the power of collaboration and community-led solutions.
At the end of the day, success in saving lives depends entirely on a collaborative network. I mean, it literally takes medical personnel in emergency departments, police and first responders on the streets, mental health professionals, public health officials, and everyday community organizations all bringing their unique expertise to the table. This is a highly complex, fast-moving epidemic. No single group is going to solve it alone. It requires a really coordinated, integrated response from every single sector of society working together.
As we wrap up this explainer, I want to leave you with a critical thought to take back to your own neighborhoods, your workplaces, and your local leaders. We've seen that the numbers can shift, right? The 2023 data literally proves that prevention efforts are making a dent, but maintaining that momentum requires all of us. So, how will your community come together to turn the tide? What role can your local organizations play in this collaborative network? Thanks for joining me to explore this vital data, and I really encourage you to use this knowledge to spark some meaningful conversations in your own community.